Can you see station 3?
Yes, ma'am.
So if you're ready, can I start the timer?
Yes, ma'am.
Okay, started the timer and here is your question. Right, if you have read and understood, kindly tell
Yes,
me,
ma'am.
considering a critical care scenario, what are the feeding options that you can offer this patient?
Okay, ma'am.
Including,
As per the scenario has been given to me, the option that I would have is to either go for enteral nutrition or either the parental nutrition. As the patient has already been given the defunctioning stoma, so I could also go for enteral as well. So in case if patient does not tolerate enteral, the patient has low GCS, I might have to go for parental nutrition, in which in enteral I have a multiple options starting from the nasogastric, nasojejunal, and percutaneous endoscopic gastrostomy and feeding jejunostomy, feeding gastrostomy, and parental nutrition. I have two main things: total peripheral nutrition and peripheral parental nutrition.
what is the route of administration of total peripheral nutrition? Refer
Ma'am, they
to,
are basically given through a central IV lines.
yes, PIC line or central IV line. Okay,
Yes.
why?
Ma'am, because they have a very high viscous and they are more phlebitic. They have a very high osmolarity. If they would be have been given through a smaller veins, they would lead to the
Yes.
more shaftitis. So that is the reason why it's being preferred to give it through a large channel or the main veins.
Can you tell me what are the constituents of TPN,
Yes,
total
ma'am.
peripheral nutrition? Yes.
Ma'am, it's basically composed of the water, carbohydrates, along with the carbohydrates, the fat emulsions, and the nitrogen and trace minerals, trace elements and minerals, and certain kind of drugs such as adenine and insulin.
Good. Okay, can you please tell me what is the main source of carbohydrate which is used in TPN?
I'm dextrose.
Glucose. Okay. Yeah, dextrose.
Glucose.
Okay, can you please tell me, other than glucose, what is the next highest energy source in TPN?
Now it's fat. It's around 30
Okay.
to 40%, as 1 to 5 mg per kg per day.
Can you suggest what are the indications of TPN
It
other than
depends.
this
Like
scenario? Yes.
it could be related to neurological issues. It could be related to the antral issues, such and it could be other than that could be a trauma, multiple sepsis, and a patient in the critical care. In
Yes.
case the patient has a neurological issue, such as the patient in the post ischemic infarct, unable to maintain a patent solar reflex in that patient, and in patient who had a large bowel being resected, such as the patient of the short bowel syndrome, who had a multiple intestinal resection, who had inflammatory bowel diseases, intestinal obstruction secondary to any other cause, and any kind of pancreatic or any fistula which are high output.
Good. Good. Okay, can you tell me how would you assess the nutritional status of this patient?
Ma'am, there are multiple ways. First of all,
Yes.
always start with the history, physical examination,
Yes.
and in the physical examination, the main thing that I'll be doing is to basically the patient's weight, and in anthropometric measurements, I'll be going for the mid-arm upper circumference and skin fold thickness. And along with that, certain biochemical testing, they can tell me about the nutritional assessment of the patient, such as the albumin, and along with the albumin, immune function, which can be which can be assessed through the history if the patient has a poor wound healings and the lymphopenia in the laboratory findings.
Very good. Okay, can you please tell me what are the advantages of enteral feeding over TPN?
The first and the first thing that is really essential about enteral nutrition is it does not let the mucosal barrier of the intestines to go away. It provides a trophic effect to the mucosa, due to which the translocation of the gut bacteria does not occur, which is basically does not occur in the parenteral nutrition. So the gut mucosa remains intact, and it's very easiest, safe, and cheaper method.
Good. Can you please tell me what is the daily nitrogen requirement of a human being? Healthy and ill, critically ill, both, please.
Total basal requirement or just nitrogen?
Just nitrogen.
Sorry, ma'am, that I cannot recall.
Okay, and we'll revise that. Right. If you can tell me, please, what do you understand by the term refeeding syndrome?
Okay. Whenever the body is in starvation for the longer period of the time, the body start doing the catabolism more. So
Yes.
whenever the shift from catabolism to anabolism, whenever the body has been provided with the nutrition, so what body does is it start restoring all those essential nutrients. So instead of utilizing it, they are getting absorbed in the body, and the patient presents to you with the hypocalcemia, hypophosphatemia, and hypomagnesemia and thiamine deficiency, which basically exacerbate and manifest in the form of neurological, pulmonary, and cardiovascular complications.
Very good. How would you know a patient is suffering from malnutrition? What are
Ma'am,
the signs you look for? Yes, please.
the malnutrition sign of the patient BMI has been less than 18.5 kg per meter square. Along with that, patient has a history of weight loss more than 5 to 10% in the last 3 to 6 months,
Yes.
and has a very high catabolic state, unable or unlikely to have been eaten in the last 5 days, and a patient has a poor absorptive capacity, and along with that, in history of physical examination and anthropometric measurement, patient having a decreased skin fold thickness and decrease in mid-arm, upper arm circumference, low albumin, and decreased weight. All of these are the indication of the malnourishment.
Very good. Uh, how would you know, or what are the complications of TPN?
Ma'am, the TPN complication can be related to the line insertion. During the line insertion, it can
Yes.
be damage to the carotid artery, damage to the thoracic duct, damage to the brachial plexus. It can lead to the even formation of hemothorax, pneumothorax, and cardiac tamponade. And along with that, if it been remain for a longer period of time, it can lead to the sepsis. And the other thing that can occur is it basically the deficiency of essential nutrients and essential fatty acids and the trace elements, and related to the a hyperfeeding, or you can say overfeeding. If there have been a lot of amino acid, that will lead to the aminoacidemia and aminoaciduria, and due to increase in carbohydrate, it will lead to the hyperchloremic metabolic acidosis, hepatic ketosis, water and salt retention, and due to secondly to increase in the fats, it lead to the hypertriglyceridemia and hypercholesterolemia,
Yes.
and due to
Okay. Can you please tell me what are the long-term effects of using TPN on the gut?
ma'am, whenever it lead to the atrophy of the mucosa of gut.
How does that take place? Can you please explain?
Because whenever the gut has the nutrient coming through the oral or any other route, which
Yes.
basically touch the mucosa of the gut, that lead to the release of the local hormone, which provide a trophic effect to the mucosa and maintain the integrity and IgA and endothelium of the gut mucosa. Whenever this stimulus does not come, this will lead to the atrophy of the mucosa that occurs in the patient who has been undergoing the TPN.
Very good. Can you please tell me, you've just mentioned that glucose is the main source of energy in TPN,
Yes, ma'am.
but can you name few disadvantages of just using glucose as the main source?
Basically, what happened is when you are going to give glucose as a main source in the patient who's already in the catabolic state, there's a lot
Yes.
of stress hormone that lead to the hyperglycemia in the body, due to which there is insulin resistance. So whenever there's insulin resistance, we're giving more and more sugars. The
Good.
body is not utilizing it enough. First thing
Then,
is going to do this, and the
yes.
second thing, due to this decreased utilization, this carbohydrate going to accumulate in the liver in the form of fat, giving
Very
the
good.
fatty liver and increase in LFTs. And the third thing, due to increase in the carbohydrate, there is more and more oxidation of it, which lead to the increased CO2 production and more damage to the pulmonary system and leading to the ventilatory failure.
Excellent. Excellent. Okay.
Mhm.
One question more. You said prolonged use of TPN can lead to mucosal atrophy.
Yes,
What
ma'am.
harm can it do? What are the implications of this mucosal atrophy?
Ma'am, what happen is whenever there is atrophy of the mucosa, the basic cell binding, the thing that binds the cell together gets loosened up. There's intercellular channels to do with the translocation of the
The
commensal or the flora of the
yes,
bacteria of the gut occurs, which can lead to the sepsis, MODS, and all other
more
complications of the
exactly.
sepsis.
Uh, I forgot to show you this earlier. But what
Could
is
I
this
define
arrow
this one?
pointing at? Sorry.
Ma'am, these are basically jejunum, showing the stacks of
Yes.
coin and multiple bowel loops,
So
and
this
they are
arrow is
descended.
showing at obstruction.
Jejunum.
Yes. Good. 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 Excellent. Good. Thanks.
Thank you,
Right.
ma'am.
Just one nitrogen balance
Yes,
question
ma'am.
you
Yes, I
can
couldn't find it
tell me,
anywhere.
and then yes, it's these are given in the traditional notes. And how to calculate the normal value of nutrition?
Okay,
How would you go? Would you
ma'am.
give
Basically,
like normal,
ma'am,
and then in case of burn, and then in case of post surgery
trauma and
patient?
post surgery. Okay,
Yes,
ma'am.
three.
What happened is, basically, there are certain books which says normal daily requirement is around 25 kilocalories per kg per day. Certain
25 to
says it's
30 kilocalories
yes,
per
25 30
day.
kilocalories per kg
Yes,
per day. In the case of
yes,
sepsis, in the case of sorry burn, what you have to do
yes,
instead of providing these basal requirement, you have to provide the maintenance that is at
yes,
least 70 kg per person or area of the burn per day. In the
yes,
case of surgery, it would be around 35 kilocalories per kg per day. In cases of in cases
sepsis.
of sepsis, it would be around 45 kilocalories per kg per
Yes,
day.
yes. So the demand increases of nutrition.
Yes,
This
ma'am.
is
As
what we
per
have to
the
show
categoric code.
as per exactly. Right. I think, covered everything. Just one that nitrogen thing that you'll read.
Yes, ma'am.
It's given like 0.15 gram per kg for a healthy person and zero point 0.3 gram per kg for critically ill person. So amount doubles for
Okay.
the critically ill person.
Ma'am, is it nitrogen or protein?
Nitrogen, I said.
Okay. 0.15 and zero point 0.3, right, ma'am?
Yes, gram per kg.
Okay. Thank you, ma'am.
Right, most welcome. So you've answered the feeding syndrome very nicely. So nothing is left. Even they can show you the X-ray and they can ask you how to identify or what is the X-ray showing. So that you have already told me very nicely. So very good, excellent.
Okay, ma'am, I
Any
have a one question.
yes,
Like the X-ray that you have shown to me, like we always been taught that whenever you have been given an X-ray, you start with saying that this
yes,
is the X-ray.
ABCD, yes.
So we have to do the same thing in this.
In yes, in critical care scenario,
Okay.
but you have to say it in one breath, quickly within
Okay.
30 seconds. All
Okay.
A,
And
B, C. Yes,
okay, ma'am. Along with one thing, that along with defining there has been a descended bowel loop and multiple gas all over in the jejunum. Should I comment on the bones or not? Like
you
there's no
should
bone
tell there is coin appearance, which is typical of that.
jejunum.
Coin appearance to the small bowel dilatation or obstruction. You necessarily may not know if it's duodenum.
Jejunum.
Yeah. So you'll say coin appearance. Where is the coin appearance? What is called
And
the coin appearance? See,
the red one.
these
Yes, specks
these
of
are
coin.
stack of coins. Yes, on top of each other. So this is called this is the sign of obstruction of the small bowel.
I should
So
okay.
that you have to mention. But what bones? Is there any bone deformity that you can say? You can just say quickly. There's no bone deformity. There's no
Okay, okay.
any other yes deformity. But
You
the
have to
only thing
even tell the negative findings as well.
first begin with the positive findings and then at the end you can say there are no apparent bone deformities. Yeah,
Okay, ma'am.
because there are none. And here is the source of this picture and of the questions that I asked you. Yep. Right. Here has been a lot of discussion. Amount of nitrogen, 0.15 for a normal person and yes, gram, yes, per kg in normal, and double in case of critically ill patient. Yes, double it. Just keep one formula in your mind and just double it. Yes, true. 0.3 in critically ill patient. Yes, true. Good, excellent.
Thank you, ma'am.
So, anyone else want to